Hello, everybody. So, because of everything that has been going on with COVID-19, I would like to express my view on this. If I was a leader in this pandemic, somebody that people looked up to for leadership, I would do things a little bit differently than what is happening right now. Now, if I was responsible in how things were going to be set out, how they were going to be planned, I would completely close everything. Close food restaurants, fast food, groceries, everything. Everything will be closed and everybody will have to stay indoors for a certain amount of period. Now, before this would happen, I would give people enough time to go to the store, buy the stuff that they need, but at the same time also limit the amount of things they could buy, like toilet paper, milk, eggs, necessities, things like that. Because if you haven't seen how we reacted the first time this happened, everybody rushed to the stores and bought bulks of items. They bought out toilet paper. People couldn't find toilet paper, milk, eggs. Aisles at the grocery store were all empty. So before I would set my views into action, I would limit the amount of items people could buy, and I will also try and limit one family member going into the store and buying, for an example, a bag of or a roll of toilet paper, and that the other family member did the same thing, kind of in a way that they're kind of cheating the system. I would try and do something so that wouldn't happen. And the reason I think this is the best way is because in China, if you haven't seen the news or heard the news, late last week, the citizens of China were able to leave their home without having to wear masks or gloves or anything, because the governor or whoever runs China was able to make everybody stay indoors and allow nobody to go outdoors. And during this time, while everybody was indoors, there were professionals outside cleaning, spraying down the streets, just so they could get rid of any type of, so they can get rid of the virus on surfaces, because this virus does tend to live on the surfaces, depending on what it is, for a couple of minutes or hours. So while they did that, everybody was indoors, and that did take a while. They were indoors for roughly, I want to say, a month, maybe a little bit more. I could be wrong, but during that time, they were able to find, excuse me, a solution into this disease. And I think that is a smart way, because here in the United States, they are doing that, but they're still allowing people to go to work. They're still allowing people to go out and buy groceries. They're still allowing travel. So I think we're not really doing what needs to be done. This is getting out of control. The cases in the United States are surpassing any other country. They surpassed China, where this originally started. So that's scary. So I think we need to take this into more of a serious matter and to stop playing around. Because if we're not really telling people that they can't leave their house, they're not going to stay indoors. Nobody wants to be indoors. It's boring staying indoors. So if we're not really enforcing that, people are going to still go out in the store. They're still going to leave their house, and that's not going to help. Now, I do know that this virus is mostly targeted towards older people or younger kids. And these cases in the United States are mostly older people. But that still doesn't mean that younger, healthier people can't get this. It's just a very scary time, and for us not to be able to take it as serious as we should, I think that it doesn't make sense. If we've seen the results that China has had, why aren't we doing that? It started there and they were able to fix it, so it's our turn to fix it. Even if it's not totally that way, we had to take it a little bit more serious. I think that we aren't, and that's just sad, because there's people that are just dying. Hospitals are being overfilled. Health professionals are putting their lives at risk to help people, and I think that it just needs to be taken serious. I think that we have to better ourselves and actually listen and really, really take this into consideration and try and do something different, because what we're doing now, it's working, but it's not working. It's not bringing down the number of cases. People aren't listening. There's still people that are getting affected, and it just needs to be dealt with in the most efficient way. And I think this is the most efficient way, is to just stay indoors and completely restrict any outside travel. Thank you.